So, this topic is about the social construction of mental illness in the age of neuroscience. Basically, social constructionism is the theory that reality, knowledge, and meaning are not objective but are actively created, maintained, and transformed through ongoing human interactions, language, and shared culture agreements. So there is some mental illness issue like mental illness are health conditions involving change in the emotions, thinking or behavior. Mental illness can be associated with distress and problems functioning in the social work or family activities. In the mental illness, the history of the mental illness is littered by the explanations of normality and abnormality, power struggles, and search for cures. Myths about mental illness have resulted in centuries of stigmas, marginalizations, and maltreatments. Within its history, mental illness has featured as a sign of possession, a special gift, or a moral failure, or medical curiosity, a genetic defect, or an economic and social blight to be forcibly eradicated. Some, if not all, these versions persist in the world today. Neuroscience. Basically, neuroscience is the multidisciplinary scientific studies of nervous system like brain, spinal cord, and nerves, exploring its development, structure, function, and disorders. Social constructions of mental illness in the age of neuroscience. Mental illness is real and cause real suffering, but society play a big role in how we understand and treat it. Even in the age of neuroscience, where brain, skin, and medicines are common, mental illness is not understood through biology. Social pressure, culture, and daily life problems strongly affect the mental health, especially in the Pakistani societies. The society tells and decides whether there is any mental illness or not, while the neuroscience tell us the chemistry of brain that what is happening in the brain. From weakness to illness, in Pakistani society, especially in Pakhtun society, problems are often seen as weakness of faith or character, or may be called kamzor, which called the weak, and may be told to pray or may be strong. On the other hand, doctors may call these problems depression or anxiety and give the medicine. This all may be helpful, but it's ignore the real cause like the poverty, family pressure, unemployment, academic stress, etc. Mental illness depends on the society. There is no test or brain scan that can fully diagnose the depression or anxiety. Doctors depend upon the behaviors and feeling of the patients. For example, if we take a Pakistani student who fail in exams, may feel hopeless, may not sleep properly and avoid the pupils. These students may be diagnosed with depression or anxiety, but the real problem could be pressure of parents or fear of failures. This all scenarios show that the mental illness is linked to social condition, not just the brain. Brain science is not the full truth. Brain science can just tell the mental illness scientifically, but do not tell the full truth or background story or cause of the mental illness. For example, a laborer who is constantly worried may show stress in the brain studies, but his stress comes from low income, inflation, or the job insecurity. Treating him only with medicine ignore the social problems. Culture decide what is normal. In Pakistan, some behaviors are judged differently depending on the culture. For example, a person talking to himself may be accepted in some communities but seen as a mental illness in cities. Similarly, men are often expected to hide the emotions while women expressing sadness or sometimes labels over the emotions. There is the medicine instead of the social solution. In Pakistan, mental distress is often treated only by the tablets. For example, a young person suffering due to unemployment may be given antidepressants, but not help is provided for skills training or job opportunities. This approach controls the symptoms but do not solve the real problems. A balanced view. Mental illness in both real and society influence the brain matter, but life conditions matter too. For example, someone with anxiety may benefit from medicine, but real improvement come when they also receive family support, counseling, financial stability, and understanding from the society. There is the stigma reinforced silence. In Pakistan, mental health stigma often prevent the people from seeking help. For example, families might hide a member's conditions due to fear of social judgments worsening the issues. There is some gender dynamics matter. Women in Pakistan often face a unique pressure. For example, marital expectation, domestic responsibilities that contributes to mental distress. Their symptoms might be dismissed as hysteria rather than treated seriously. So, urban versus rural difference. Basically, mental health awareness and resources are often concentrated in cities. Rural areas may lack access to psychiatrists, leading to untreated condition or reliance on the spiritual healings. There is the role of the education, like the school, colleges, universities can contribute in both scenarios. These institutions can either exacerbate stress by high pressure of getting high marks. In other scenarios, these institutes promote the mental wellness by counseling the service and stress management. So, in the social constructions of mental illness in the age of the neuroscience, from weakness to illness, mental illness depend on the society. Brain science is not the full truth. There is some culture decides what is normal. Some medicines instead of the social scenarios, a balanced view, some stigma reinforced silence, some gender dynamics matters, urban versus rural difference, and some roles of the education. So, as a conclusion, in the age of the neuroscience, mental illness is not just a brain disease and not just a social label, it is a shape both by biology and the society. In Pakistan, factors like poverty, family pressures, unemployment, and cultural expectations strongly affect the mental health. Understanding this help treat the people with care, respect, and real situations, not just the medicine. So, this topic is all about the social constructions of the mental illness in the age of the neuroscience. So, to understand the role of the educations and their differences, we must understand what is the social illness and how it will be related with the neuroscience. So, this is the end of the topic. Thank you so much.